And so then I approached Doug, and Chet and I emailed some and said, I've got this aid organization that I set up as a medical student. We filed last year to be a nonprofit. We have contacts. We could basically arrange everything. Would it be possible for a couple residents to go? And then that has evolved into now lots of residents are going.
I think Doug Char's primary concern was experiences. He went down to Katrina as part of the disaster management group, right. And his primary concern was people just showing up and saying, "I'm here to help," but then having to worry about the logistics of food and shelter and water, and so after I was vocal about can we do something, Caleb, who had previously set up the not-for-profit, said, "I have tons of contacts. Let's just get down there and get it set up," and we did a little bit of arranging here before we headed down, but. We have nursing staff traveling down. We've had techs. We've had
your wife.
EMTs. My wife, who's an occupational therapist, went down and served as a quasi pharmacy tech. So we're not just open for physicians. We've established. It sounds like there are probably 3 nurses that are going to travel down next week. We have some more nurses committed for the month of March, and that's actually been a recent need. We were fortunate when we were both there, and especially when Caleb was there, that there were quite a few Haitian nurses that were volunteering. There were a large score of nurses that had come up from, was it South Carolina?
South Carolina. Pickens.
Yeah, so there were some nurses that came up from South Carolina, and they all, again, their time ran out. They spent a week, 10 days down there, and they got to get back to their lives. I think they've been very fortunate in terms of the nursing administration staff that have committed to trying to work with the nurses as far as getting time off to go down too. It doesn't just affect me when we made a decision to go down. I've had there have been other residents who picked up my shifts. The role that I played in the emergency department when I left is one of kind of an extra body, jack of all trades, kind of helping hand we teach. And they went without me, and so there wasn't somebody to kind of help when the residents needed help. There were people who filled in shifts that we needed filled in. So our residency, our families, everybody was impacted, I think, and kind of did their part for us to be able to go down.
Disaster situations there's a disproportionate allocation of resources. So I feel like at some point we were pretty well set up in Tigwav, we had enough staff, and then as groups had to leave, then you're looking at 1 or 2 Haitian nurses and 2 American physicians trying to see 400 people a day. With a language barrier, that's not that feasible. So there's going to be a need for continuing people there, but also if people are interested in going, there's just as we spend more time and get more connections and find out about the needs on the ground. I talked to a guy in the airport coming home through the Dominican. He was the only aid worker in a refugee camp of 5,000 people, the only guy. And when he left, he had no replacement. So I know there are pockets of need. We know that there's need out there. The best thing, if somebody's interested in going, is contacting an aid organization that can plug them in so that they meet the need out there. And like Chet was saying earlier, don't just contribute to, showing up and then being a mouth to feed and a mouth to give water to and someone to have to give shelter to. An appreciation for how blessed I am to live where I am and to train where I train. I was blessed to have an opportunity to serve. We commonly take care of people who are in an emergency situation. They need help right away. They may not be able to communicate what's going on, but to be able to provide help to someone whose entire country is an emergency, their entire country can't convey what's going on, was humbling and gratifying. And it was also encouraging to be able to see that this training that I'm getting in Barnes and being in the emergency department here really prepares you, so that when I had a guy who had a tension pneumothorax, and I had a guy with an open head wound and exposed brain, and I had 2 pregnant ladies, and all those patients over a course of a week, I'm prepared. So that's gratifying that the training is worth it.
I had the opportunity to do what we do, and I felt like watching it on TV for the couple days before we had a chance, or probably a little bit longer than a couple days before we had a chance to go down, I felt like this is what I do, this is where I need to be. I mean, we are emergency trained, and so I felt like that to have the opportunity to, be the emergency doctor in an emergency disaster situation, I think blessed is the best word to explain it.